Why do people still talk about trans fat if many labels say 0 grams? Is this an old nutrition panic? Or is there a real reason a tiny number on a package can still matter?
The main concern is industrial trans fat, especially from partially hydrogenated oils. Food makers used hydrogenation to make liquid vegetable oils more solid, stable, and useful in pastries, shortenings, frostings, and shelf-stable snacks. That processing can bend some unsaturated fats into a trans configuration. Your body can burn or store them like other fats, but their shape changes how they interact with membranes, enzymes, and lipoprotein metabolism. What made industrial trans fat stand out was the lipoprotein pattern. Compared with many other calorie sources, it tends to raise LDL cholesterol, the ApoB-containing particles that deliver cholesterol into artery walls, while also lowering HDL cholesterol, the particles involved in reverse cholesterol transport. That double movement is why a small habitual dose can look bigger than its calories would suggest.
But if the serving has only a fraction of a gram, why not ignore it? Are we talking about one cookie once a month or the pattern of a pantry built from the same kind of fat?
Exactly. The evidence is strongest as a population recommendation. Keep industrial trans fat as low as practical. Cardiovascular risk comes from years of lipoprotein exposure, blood pressure, diabetes risk, smoking, genetics, and diet quality together. So the smart move is not panic over a rare dessert. It is removing a fat type that offers no required nutrient and has a worse risk profile than unsaturated oils.
So the replacement matters, right? If a company takes out partially hydrogenated oil but adds a different hard fat, how should someone judge whether the new product is actually better?
Yes, some reformulation uses interesterified fats or palm-rich blends to create structure without partial hydrogenation. A recent controlled feeding trial in healthy adults found no significant differences in several inflammatory biomarkers when comparing two chemically interesterified fats with native palm olein over 8 weeks. That is reassuring for those selected markers, but does not prove every replacement is ideal. The broader diet still matters. Choose foods with mostly unsaturated oils, fiber-rich ingredients, and less ultra-processed repetition. A key caution: do not turn this into fear of every molecule labeled trans. Ruminant foods, like dairy, contain naturally occurring trans fatty acids, such as vaccinic acid and trans-palmitoleic acid. A 2026 review of randomized trials and prospective cohorts did not find dairy trans fats associated with increased cardiometabolic disease risk, though one analysis saw a slight HDL decrease in enriched dairy trials. The strongest warning is about industrial sources, not trace natural amounts in ordinary foods.
When someone is standing in the aisle, what phrase should make them pause? Is it enough to read the big number, or do they need to scan the ingredients every time?
Read both. Start with serving size, then trans fat grams, then ingredients. If the label says 0, but the ingredients mention partially hydrogenated oil, treat the food as a possible small source and ask how often you eat it. One serving at a party is not the same as 2 packaged snacks daily. The ingredient list is your exposure audit.
Who gets the most practical benefit from being strict about this? Is it mainly people with high LDL, or is it just a universal housekeeping rule for everyone's pantry?
It is universal, but not equally urgent. Someone with elevated LDL cholesterol, known cardiovascular disease, diabetes, a strong family history, or a diet built around packaged baked goods has more to gain. Preconception research also points toward dietary patterns higher in fruits, vegetables, and omega-3 fats and lower in trans fats and processed foods being associated with better fertility, though evidence is inconsistent and often indirect. Pregnancy deserves a specific boundary. A 2026 systematic review found the strongest signals for industrial trans, 18:1 isomers. Biomarker-based studies linked higher exposure with increased preeclampsia risk and reduced fetal growth indicators. But dietary questionnaires were inconsistent because they often could not separate industrial from ruminant trans fats. So the advice is practical, not extreme. Avoid partially hydrogenated oils, emphasize nutrient-dense foods, and discuss individualized nutrition concerns with prenatal clinicians.
If someone cleans up their pantry, what should they expect to notice? Will they feel different? Or is this mostly something that shows up later in blood work and long-term risk?
Most people will not feel trans fat leaving the diet. Success looks like fewer products with partially hydrogenated oils, more unsaturated fat sources like nuts, seeds, fish, and liquid oils, and a better overall dietary pattern. If someone is tracking cardiometabolic risk, their clinician may follow LDL cholesterol, non-HDL cholesterol, ApoB, triglycerides, blood pressure, and glucose markers. But you should not credit one label change for everything. The whole pattern moves the numbers. And there are clinician boundaries. If you already have heart disease, very high LDL, diabetes, kidney disease, pregnancy complications, and eating disorder history, or you're making major diet changes for fertility or weight loss, do not rely on a trans fat checklist alone. Use it as one piece of care. Medication decisions, pregnancy monitoring, and aggressive lipid lowering need medical guidance, not grocery label improvisation.
So the calm rule is, don't fear a trace amount in real food, but don't give industrial trans fat a regular parking spot in your kitchen. Read serving size, read trans fat, read the ingredient list, and replace those products with better everyday fats.